Joining us now is Dr. Ashish Jha, director of the Harvard Global Health Institute. Dr. Jha, good morning to you. Let's begin right now with that headline out of the CDC, a startling one indeed, that the total number of infections is actually 10 times higher than reported. We could be looking at 20 million cases. How much does that concern you about where we are and where we might be headed?
Yeah, so good morning, and thanks for having me on. On one hand, there's some good news there that maybe more Americans have been infected and have recovered. But even if we take that number of 20 million, that's about 7% of the population. That means 93% of Americans have not yet been infected. We're still very, very early in this pandemic. The other part, of course, is that it says we're missing 90% of the cases because we don't have enough testing in our country. And so the idea that too much testing is leading to too many cases, the CDC finding that we're missing 90% of the cases because we can't test enough people is really, I think, laying, that argument probably just doesn't make much sense.
So are you saying right now that we do not have enough testing capacity for these numbers?
We do not. We do not. We should have. We've made progress. We're up to about 500,000 tests a day, and that's improvements. But we're way below where we need to be if we're really going to use testing as part of our strategy to get this infection under control.
So we just heard about Arizona and Texas both pausing reopenings. The governor of Texas saying that this will help corral the spread. Is pausing reopening right now enough?
It is not. Look, the horse is mostly out of the barn here, and we got to do something to get the horse back in the barn, to use that analogy. And therefore, just pausing basically says, okay, we're going to tolerate the level of infection and spread that's happening right now. And that's going to overwhelm the hospitals very, very quickly. What states need to do is really start reversing some of this. They opened too fast. They opened up against where the data and evidence was, and they really need to start making some reversals.
And what role do masks play in all of this going forward, given that just 2 of the 10 states seeing this recent spike are mandating mask wearing in public?
I think we have to have mandatory mask wearing. Look, I know some people find it inconvenient. Other people think it's an abridgment of their freedom, and I understand that. But the bottom line is that we do know masks help. They reduce infections. They reduce severity of infections potentially. And we have to have mandatory mask wearing. It's a pretty small step to take to make sure that our economy can stay open and our hospitals don't end up getting overwhelmed.
Marcus mentioned that these numbers, that deaths are not rising right now. But I want to ask you, is it just a matter of time? Are the death numbers that we're seeing today just a lagging indicator?
So that's always our lagging indicator. They take about 3 to 4 weeks after infections start rising that you see deaths, right? Because people have to get infected, they get sick, they go to the hospital, they're in the ICU for a week or two, and then they die. So there is that time lag. Second, a lot of young people are getting infected, and so they tend to have lower mortality. But unfortunately, I worry they're going to spread it to their parents and grandparents. So it might take a little longer before we start seeing older people get sick again and then getting in the hospital and unfortunately dying again.
And very quickly, Dr. Jha, if you will, the message that you've got for people watching right now, in order for us to stop this, to reverse course, what do they need to do?
Yeah, I think the message here is simple. We're early in this pandemic. People have to wear masks when they're outside, wash their hands, maintain social distance, and put pressure on your political leaders to take this seriously. It's going to be much easier to get through it if we do that.
Dr. Jha, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.